In recent weeks, there's been much debate about the crisis in our healthcare system. I'm going to take a look at 5 myths about the Irish healthcare system. Myth number 1. The flu outbreak causes a trolley crisis. In recent weeks, a severe flu outbreak has been reported to have caused a serious crisis of patients on trolleys in our A&E department. On Wednesday the 17th of January, over 550 people were waiting on trolleys for a bed, including 13 children. Leo Varadkar said that if it was simply a matter of funding, the issue of overcrowding would have been sorted by now. Every year, the Minister for Health promises to fix the problem, so why is it still happening? There isn't a lack of beds or wards, but there is a lack of staff to open up these beds. The recruitment embargo, which was in place between 2009 and 2014, is still causing staff shortages. In addition, the lack of funding in primary and community care means that Ireland has very high rates of hospital admissions for chronic conditions such as asthma and COPD. A recent OECD report stated that Ireland's healthcare system is hampered by the 2-tier financing system, the absence of universal health coverage, as well as the lack of integration of different state agencies. So it's not the flu that causes patients on trolleys, but rather a lack of staff and under-resourcing of primary care. Myth number 2. Ireland has the 5th highest health spending in the world and the 2nd highest in the OECD. While these figures are technically correct, they are skewed by how health spending is calculated. For example, it includes individuals spending on private health insurance, which increased from 21% in 2008 to 30% in 2015. This is the 3rd highest in the EU. So when Varadkar boasts about how much is being spent on health, we should remember that those statistics are not reflecting the reality of the Irish health system. Myth number 3. Healthcare workers are overpaid. While there are some people in the HSE on high salaries, they are not the frontline staff like nurses or junior doctors, but rather top consultants and managers. While nursing staff decreased by 3,000 between 2007 and 2016, the number of senior managers increased by 40% between 2012 and 2016. Money is also being wasted on paying agencies for staff instead of directly employing workers. In the first 5 months of 2017, 41 million euros was paid to agencies. The workers then only receive part of that money and are left without pension entitlements and job security. Myth number 4. Old people are bed blockers. This perpetuates the idea that old people attend hospital when they don't need to and stay too long. However, if the closed wards and beds were opened up with appropriate staff, anyone who required hospital care would be able to get it. Also, the significant cuts in home help and other community care has left many older people unable to cope and being forced to attend hospital to receive the care they need. Myth number 5. Ireland is the safest place in the world to give birth. This myth is perpetuated by the anti-choice movement as an argument for retaining the 8th Amendment. They claim that Ireland has one of the lowest maternal mortality rates of 1 per every 100,000. However, the reality behind that figure is that maternal deaths are not recorded as related to pregnancy. For example, the tragic death of Savita Halappanavar would be recorded as septicemia rather than as pregnancy complication. These statistics, which seem to show a rosy picture of maternity care in Ireland, hides the dark truth of deaths caused by the 8th Amendment. In addition, the 8th Amendment means that pregnant women have no right to consent when it comes to their health care. Many women have faced the threat of court action, for example for refusing to have a C-section. If you want to join the fight for a better health service, the Still Waiting campaign has organised a conference on the 27th of January.